Hey there, all you cool cats and kittens. Dr. Peterson here with Regions EMS for today's daily COVID-19 update. Today is Monday, April 6th, 2020. Information presented is current as of today, and we make no guarantees that it'll be current tomorrow. We'll keep you updated on our website, regionsems.com. Click on the COVID link, and you'll find a page of resources and videos that we've compiled, and we'll always review them and put the date that they were most recently reviewed at the top of the page, so you can be sure that that information is current. Well, I had my first day off this weekend in over 3 weeks. So I got caught up on some Tiger King episodes, if you may not have noticed. Thought about changing my name to something like, I don't know, Bjorn Exotic, Bjorn COVID, Bjorn Coronavirus. Maybe a little too soon, not appropriate. We'll just stick with Dr. Peterson for now. Today we're going to talk about some things that you can do to keep yourself safe again, just as a refresher, as well as some new recommendations from medical direction. First, let's get into some statistics. So worldwide, there are just over almost 1.3 million confirmed cases with just over 70,000 deaths reported. And you can see the hot spots there are the United States and Europe, where it's starting to fade out a little bit over in the Far East, which is good. CDC reports in the United States just over 300,000 confirmed cases, with just over 7,600 deaths. State of Minnesota, we are at 935 confirmed cases. I'll bet we'll break 1,000 today, with 29 deaths attributed to coronavirus. A third of these are due to community spread. And what's interesting is we are not seeing the exponential growth that was expected. We're seeing more of a linear growth. So I think that some of the stay-at-home and social distancing stuff is making a difference, at least here in Minnesota. We go across the river to Wisconsin, a little bit busier there, just over 2,200 positive cases with 68 deaths. But again, the Wisconsin infectious curve is also linear, not seeing the huge exponential growth like was expected in both cases. Couple brief announcements before I get into some of the topics. So first of all, MRCC would like to implement the red, yellow, green triage radio report format so that when it does become really busy, we are already used to doing that. So again, you don't need to give a full report, just need your patient's age, gender, chief complaint, destination hospital, ETA, vitals, and then red, yellow, or green. Red meaning the critical patients, the stayed patients, trauma team activations, code blues, stroke codes, abnormal vitals, that kind of thing. Yellow is going to be most patients, and then green would be the very minor, stable, ambulatory, probably triage appropriate patients. Red patients, you may get asked a couple more questions just to clarify, but just let's go ahead and start using that. We can implement that right now. Also, the ECMO team is still open for business. Although they will not be seeing patients at Regions, they will be directing you to the University of Minnesota. But don't forget, if you have a shockable initial rhythm, think about calling the ECMO team if the patient is eligible. We still want to offer that survival opportunity to those patients if it's appropriate. Call the ECMO doc if you're not sure what to do. But again, we want to minimize scene time. Call early. Call as soon as you know that first rhythm is shockable. Let's go back to last week's trivia question. Who was Mary Mallon? We had a number of answers submitted. Everyone was correct. Mary Mallon, not surprisingly, was Typhoid Mary. What does typhoid have to do with coronavirus? Well, interesting thing about Mary, she was a cook in the early 1900s who was an asymptomatic carrier of typhoid. She infected probably, hundreds of people, if not more, and there were 51 deaths that were attributed to direct infections caused by Mary Mallon. She refused to quit working as a cook and as such was quarantined forcibly on several occasions by the local authorities. So Typhoid Mary right now is kind of a symbol of the people who may be infected with coronavirus but are having very minimal or no symptoms at all, the asymptomatic carriers. That's what we'd like to focus on today. And with that, one of the recommendations that we are putting out as medical directors is that we feel we're at a point in time where everybody needs to be wearing a mask on shift. Even if you're at the station, even if you're in quarters, the exceptions obviously being when you're eating or if you're in a room by yourself, like an office or a bedroom where nobody else is necessarily going to have access to that. But out in the day room, the common area, especially in the cab of a vehicle, we really should be wearing masks. Masks help asymptomatic people stop spreading their infectious droplets to other people. So there may be some of you out there who are infected and don't realize it. And the last thing we want to do is spread that throughout a shift, throughout a station, and decimate our public safety workforce. That would be catastrophic to our communities if that were to happen. So we need to, as inconvenient as it is, we just need to suck it up. We need to do this. We need to get through this so that we can get back to a normal life and enjoy hanging out with each other again. You can reuse the mask unless it's visibly soiled or damaged. And I'm talking about a simple face mask, or even the homemade masks would work in this situation. They're not considered PPE, but it does help stop the spread from you if you're asymptomatic to others. It helps catch the droplets that you might be spreading out when you're talking, coughing, sneezing, that kind of thing. There is a New England Journal of Medicine article that came out recently that we'll post on our website that talks about how some people, when they wear a mask, think that that means they're protected better, and so they get a little bit lax with some of their other infection prevention techniques. Social distancing, confined, spending time in close proximity to someone else, touching your face, touching surfaces, that kind of thing. So I want to be very clear that wearing a mask does not replace everything else that we're doing. It is in addition to everything else that we are doing. And as medical directors, this is our recommendation. Ultimately, your agency, your city needs to decide how to implement this, how to enforce this, or if they choose to do something else. But this is our recommendation as medical directors, and this will be communicated to your agencies. One thing that you should be confident in is that your PPE works. What we're learning from places like Seattle, where they were one of the early hotspots of this outbreak, the spread that they're seeing in their public safety workforce is not because of PPE failure. It's mostly because of community spread, either outside of work or in the station in other areas where they're not wearing PPE. What they're not seeing really is infection spreading from an infected patient to a public safety professional when that person was wearing appropriate PPE. So review our guidelines. There's a summary document on our website that lists all of our current recommendations to date, updated today. So the masks, the eye protection, the gown, the gloves, all of that kind of stuff does work to prevent the spread of this infection. So you can do that confidently, knowing you're protecting yourself, your families, your coworkers back at the station. And then we also need to just practice our social distancing. Take turns eating so you're not all sitting around the same table at once. Don't gather together in the station, in the ambulance bay, around the nurses' workstations in the ER. We just have to, again, suck it up, just use some social distancing. Let's get through this. Let's stop the spread of the virus, flatten the curve. I want to get back to a normal life. My kids want to play baseball this summer. We got to get through this. Let's all do our part so that we can stop the spread of this coronavirus. All right. Let's talk about today's trivia question. You can send your responses to regionsems@healthpartners.com. I've seen several words out there used to describe the plural of virus. So my question for today is, what is the correct plural form of the word virus? Is it viruses, viri, or viridae? I've heard all three used, so I'm curious what you think. Which one is the correct plural form of the word virus? Again, questions, comments, answers to our trivia, regionsems@healthpartners.com. Check out our website, regionsems.com. Subscribe to our YouTube channel, Regions Hospital EMS. We're going to move these video updates to a Monday, Wednesday, Friday format. There's not as much happening from day to day anymore, so obviously we'll put something out if you need to be aware of it, but stay safe, stay healthy, and we'll see you on Wednesday. Take care.